wanakaa wakiwa timamu.
Hearing is one of those childhood milestones that human beings are conditioned to believe occur naturally. Unlike speech, we do not have to learn it. It's always there, unseen and unheard. But what happens when children lose their hearing? How do they learn to talk when they can't even hear the words and sounds they're supposed to imitate? On Health Digest, Gloria Milimu looks at how cochlear implant surgeries are helping children with hearing loss reclaim their ability to hear, giving them a second chance at life to develop communication, language, and social skills. Take a look.
Deep inside the brightly lit theaters of Kenyatta National Hospital, the tiny frame of a young girl peeps from the crowd of green-clad doctors and nurses surrounding her. With her body limp from the anesthesia administered just a few minutes earlier, the air around her is full of urgency, with medical staff working with accuracy and purpose to give her the gift of sound using a cochlear implant. The surgery takes about an hour or two, but its effect on this little girl will be lifelong. For 2.5-year-old baby Kenzie Witness, all seemed well in her first year of life. Her world was filled with sweet babble and laughter, which are typical of early childhood. But sometime after her first birthday, everything went quiet in her ears. Her attention to her surroundings disappeared, followed quickly by stagnation of her speech as explained by her mother.
I realized that when I call her, when I use the normal tone, she couldn't hear me. When I shout, she'll just look as if she's just heard a sound from a far distance.
A trip to the doctor a few days later confirmed the worst. Baby Kenzie Witness had suffered a serious ear infection that had affected her hearing.
Everything about her was normal. She started walking at the age of 11 months. So you see, I couldn't understand that now at this point she doesn't hear.
The prognosis was even more shocking. She would not recover her hearing unless doctors implanted an artificial hearing aid in her ear. Back inside the theater at Kenyatta National Hospital, doctors are racing against time to implant the hearing device, an electronic module that will amplify the sounds that she can't hear. The device is placed delicately at the back of her ear, then calibrated to suit her needs using a special software that connects to the implant wirelessly.
There is usually an internal device that's put under your skin and there's a magnet to it. And then there's an external device that you use attached to the magnet. The device has batteries that require to be changed. The device needs to be calibrated to you personally so that we get to see your hearing levels.
Hearing loss can affect anyone, from adults to babies. In the latter, however, the causes range from genetics to ear infections, just like was in baby Kenzie Witness's case.
Unfortunately, our highest cause of hearing loss is usually a preventable cause, usually infections. Common ear infections that progress. We have several children who are walking around with ear discharges and people think that it's normal.
We have some infection during pregnancy in the mother, which gave destroy of the inner ear, and after born we can have some infection, some trauma.
While some incidents can be reversed or managed with medication, the more serious ones require surgery, according to ear, nose and throat specialists.
Once you get to the profound, there are many times you find that the hearing aid is not helpful to the child, and that's now when they progress to needing the cochlear implant.
Other factors that can contribute to hearing loss among children include untreated upper respiratory tract allergies that can result in ear disease. Globally, about 466 million people live with disabling hearing loss, and 34 million of these are children. When left unaddressed, hearing loss can have a far-reaching effect on an individual's life. Hearing plays a vital role in learning spoken language and supports a child's overall cognitive development. And without timely interventions, experts warn that hearing loss can affect a child's ability to develop communication, language, and social skills.
When they stimulate electrically the nerve, the stimulation is not the same. It's why we have to program and we have to do speech therapy.
Back in the operating theater, after what feels like eternity, doctors finally declare the procedure a success and start the process of pulling their tiny patient from the deep sleep induced by anesthesia. In a matter of minutes, she will open her eyes to a brand new world, a world filled with sound, the clattering of hospital beds, the hum of the machines next to her, and the ping-pong of the monitors tracking her vital organ signs. While Kenzie Witness is among patients whose hearing has been restored, the cochlear implant surgery is just the first step towards treating their hearing loss. Rehabilitation remains another crucial step for people with hearing loss who have undergone the procedure that is the second of its kind to be conducted in a public hospital in the country since independence.
You find that the patients also require to upgrade that processor after some time, sometimes usually between 5 to 7 years.
Given the high cost of treatment and rehabilitation that is often a barrier for most patients, Kenya, through a partnership with the Kingdom of Morocco, now seek to operate on at least 100 children with hearing loss in its first phase of the program.
For too long, silence has shaped the lives of many children in Kenya and across Africa. Today, that silence begins to fade, replaced with the possibility of sound, of belonging, and of connection.
Whereas SHA will be taking care of the surgery costs of the patients, the program will be taking care of the post-operative costs, which would include helping the beneficiaries adapt to the implant as well as speech therapy.
While the revival of the surgeries locally mark a new dawn for children living with hearing impairment in the country, experts say the sooner a child is identified as having hearing loss and the easier they receive support, the greater the possibility of the child learning spoken language and the lower the likely adverse impacts of the hearing loss. Gloria Milimu, KTN.